What's going on, guys? JPS back for another video, and today we're going to be reacting to how the United Kingdom's healthcare system works. Make sure you guys hit the like button, hit subscribe, consider joining the Patreon. First link in description for full reactions to British shows and movies. And let's get right into this.
Super Tuesday came and went, and the Democratic presidential race is narrowing to two very different candidates. Far-left Bernie Sanders and the more moderate Joe Biden. Biden and Sanders have clashed on the best approach to reforming U.S. healthcare. Sanders wants to get rid of private insurance altogether, while Biden proposes building on the framework left over from Barack Obama's Affordable Care Act.
Bernie says that you have to bring people together, and we have to have Medicare for all. But Bernie says, and he says he wrote the damn thing, but he's unwilling to tell us what the damn thing's going to cost. The idea middle-class taxes aren't going to go up is just crazy.
What Medicare for All will do is save the average American substantial sums of money.
The U.S. already spends more money on healthcare than any other developed country. There's one country that spends less than half what the U.S. does on healthcare, and people generally don't pay anything out of pocket when they go to the doctor. The United Kingdom. And out of all the healthcare systems we've looked at, the UK appears the most socialist. The government effectively runs the whole thing. Right now, the UK is having its own debate over how to reform the National Health Service. So how does the UK system compare to the US? And what reforms may be coming? In 2018, the United States spent around $10,500 US on healthcare for each of its residents. The United Kingdom spent around $4,000 US. That means the United Kingdom spends 9.8% of its GDP on healthcare, while the US spends 16.9%. Despite spending less, the United Kingdom manages to have healthier citizens who live longer and are less likely to die in childbirth. In 2017, life expectancy in the UK was 2.7 years higher than in the US, and the UK has roughly 1.5 times fewer deaths that could have been avoided by access to better healthcare. The infant mortality rate is lower in the United Kingdom, with 3.9 deaths per 1,000 live births, as opposed to 5.8 in the United States. And the maternal mortality rate in the US is nearly 1.5 times higher than in the United Kingdom. So how is the UK system structured so that it gets these results while spending significantly less than the United States system?
The National Health Service is a case where the British decided right after World War II that healthcare should be government's job, like paving the streets, putting out fires, running the library, running the parks.
That's T.R. Reid, author of the book The Healing of America. He traveled the world exploring different countries' healthcare systems.
It's a service you get when you need it, and you never get a bill. It's like going to the library. They don't charge you to check out a book.
Key thing about the NHS is it's a risk-sharing system. So everyone pays into it through their tax. If you need to use it, you don't have to pay anything else. So in a sense, it's not free because it's paid out of taxation.
Dr. John Puntis is a pediatrician who recently retired from the NHS. He is also co-chair of an organization called Keep Our NHS Public. All of his comments are reflective of the organization and not his personal views.
It's a fair system in that the more money you earn, the more tax you pay, and the more you contribute. But there has been discussion about whether tax should be increased to pay for sorting the NHS out in terms of the current deficiencies and problems, and that is controversial. I think a lot of people favour some tax increase, but then there are other people who say, well, maybe the focus should be on companies that don't pay tax and people that aren't paying tax as the first step.
I would call that socialized.
Something interesting about this. So in the UK, guys are arguing about whether the NHS should be funded more through taxes or not. In the United States, we're arguing over whether healthcare should be funded by taxes or not. So that's like a huge difference right there. And then looking at the metrics at the start of this video about some of the comparisons with, mortality rates, life expectancy, just the enormous portion of our GDP that is used up by healthcare. Very inefficient and overall more of a burden on the citizens. I feel like when you don't have like a nationalized or socialized healthcare, there are so many people that get left out because, you know, a lot of people don't even realize that they don't even realize they don't have health insurance. And, you know, that's not a problem. There are people who actively choose not to have health insurance. And that's, you know, if you want to do that, you're allowed to do that in the United States. What's a problem, I think, is when there's people who didn't realize that and then they have something come up, you know, because with healthcare, oftentimes you're not expecting to be in that hospital bed. You're not, it's accidents or life hits you, all that type of stuff. It's rarely expected. So when they get hit with that surprise bill, it's over. Like, sometimes you just can't recover from that. And that's why we have 1 billion GoFundMe links at all times, you know, and that's not me like, oh, I hate when people put GoFundMe up, blah, blah, blah. Like, of course, you know, you have to do that. It's just, it's messed up that that's the case. Honestly. Like, I see a GoFundMe, this person needs $100,000 in 6 days to, you know, get life-changing surgery or something. I'm just like, why is this so common? It's just weird.
Medicine. Government provides the care. Government pays for the care. It's paid for through.
And when you think about it, those GoFundMes are they're very similar to how the NHS works, because it's people actively contributing to help the collective, which is you see what I'm saying? So GoFundMe is ironically very similar to what socialized health care is. You know, when someone has an accident, okay, we pull a little bit of money from all these different taxpayers. That's what it. So we have to informally do that through platforms like GoFundMe and things like that. And that's just what's become the norm. We could just do this.
It pays for the care. It's paid for through taxes. Everybody's covered the same. To me, that sounds like socialized medicine.
The term socialized medicine has become a political football, especially in the United States.
If the NHS, if that's socialized medicine, it's great. And we hear this term mainly coming from the US, where it's used as for scaremongering. I would say if the NHS is socialized medicine, we like it. And most people are still very, very supportive of the concept of a national health service.
Each of the UK's 4 constituent countries have their own branch of the NHS, so rules differ slightly between them, but all of the branches operate under the purview of the UK Parliament. There are some services that require patients to pay something out of pocket, such as dental, eye care, and certain prescription drugs, but those fees are low compared to the US and vary by NHS branch. By one estimate from a data analytics firm, prescription drugs cost 57% less in the UK than they do in the US. Unlike with other universal healthcare systems that are only publicly funded, the government also runs the NHS. That means doctors that work in public NHS facilities are employees of the government. Most Britons receive their primary care through general practitioners, who are frequently referred to as GPs. They typically act as gatekeepers for secondary care.
The problems that people are experiencing at the moment is it's taking longer to see your general practitioner if you want to see them.
Most GPs are private contractors with the NHS. They don't charge patients for care. Instead, they earn money directly from the National Health Service. Many GPs negotiate contracts with the NHS to determine how much they can charge the government for their services. GPs may fund their own general practice facilities, or they can rent them from the NHS or private companies. One paper from the Journal of the Royal Society of Medicine found that GPs face many issues because of how general practices are funded in the UK.
Some GPs, I think increasingly, don't want to take on the running a business aspect of general practice. And so there are lots of GPs who are salaried partners, so they are paid by the practice to come in and work as a GP, but they don't do any of the business side of the stuff.
There's also a private sector in the UK's healthcare system. It's funded from a combination of out-of-pocket payments, private health insurance, and the NHS itself.
The private sector is growing because it's being consciously promoted by government, and the boundaries being blurred.
Well, I think that private healthcare has been growing at a very rapid, steady pace in the United Kingdom for the course of several decades. That's going to continue.
That's Niall Gardner. He's the director of the Thatcher Center for Freedom at the Heritage Foundation.
With regard to the National Health Service, I mean, there's no sign at this stage that the UK will be moving to a different system to the National Health Service. All British parties are committed to the National Health Service. I think that more and more Britons will be opting for private healthcare in the coming years and decades, not least because there are long waiting lists with regard to the National Health Service.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal...
I'm sorry, before I just have a comment. I was thinking, like, there are obviously a lot of problems with the NHS and having this type of healthcare. You know, sometimes I think the quality of care may not be as good. There may be some outdated systems, things like that. So I was wondering, like, is that why people are turning to these private health insurance alternatives? Because the NHS care is inadequate for them, or if they have enough money, they're going to go for the private care, which I'm sure is much higher quality. It's very complicated when even when you have the NHS and things like this. And I'm sure everyone is still grateful for the NHS, but recently I've just been hearing about a lot of problems within the NHS. And I wonder, like, if this continued growth occurs in the private sector, will that ever overtake the public healthcare side and then become a completely different system? Or will they just continue to work together in, like, this hybrid approach? I don't know. Because I'm assuming the people who are getting private healthcare, they still have to pay taxes to fund the NHS. So they're almost paying twice for healthcare, if I'm getting this correct.
An analysis from the London School of Economics found that in the 2018 to 2019 fiscal year, NHS England spent around 18% of its total expenditure on the independent sector.
There's been a blurring of the boundaries, if you like. For example, cataract surgery, which is the most common operation done under the NHS. Increasingly, it's being provided in the independent sector, and the NHS has contracts with the independent sector to do that work. There are implications in terms of staffing. Private sector doesn't train its own staff. It takes it from the NHS. It cherry picks, takes the low-risk patients, not the high-risk patients. It has an impact on training NHS staff, and this is one of the problems with cataract surgery. If they're all going to the private sector hospitals, then the NHS staff don't become experienced in doing cataract surgery, and then along the line you find it's more difficult to staff your NHS unit. So it's not without negative consequences. We are paying private companies increasingly to do work for the NHS, including American companies, and they're very well established now, particularly in back office functions and providing advice on commissioning support, this kind of thing. They're very involved, and unfortunately that's likely to increase, and it's something which campaigners are extremely worried about.
I don't think anyone really believed that UK voters would decide to Brexit.
The news that the United Kingdom voted to leave the European Union shocked the world. The NHS was a big part of the Brexit media discourse, with the Leave campaign famously claiming that the UK would take back £350 million a week that could then be funneled into the NHS. The UK Statistics Authority has since said that the claim is a, quote, clear misuse of official statistics.
My name is Holly Jarman.
I mean, obviously, bro, like, it's not that simple. You know how many costs they incurred just from leaving the EU? Like, it's... I don't know, bro. The Brexit thing, we can't talk about it.
An assistant professor in the Department of Health Management and Policy at the University of Michigan. Those promises really did hit home for a lot of people. The idea that money would come back from Europe to the UK was a very powerful symbol. It's not actually true. That wasn't really how EU financing works. But we still saw that was a big part of the media discourse and most likely part of people's judgment when they were casting their vote.
The UK officially left the EU 3 years after the original Brexit vote, entering a transitory period through the end of 2020 while the UK government negotiates international trade deals. The concerns about private American corporations engaging more with the NHS came up during the discussion of the post-Brexit trade talks with the United States.
When you're dealing in trade, everything's on the table. so NHS or anything else. They're a lot more than that.
Backlash to President Trump's comments on the NHS led to many British politicians assuring their constituents that the NHS...
Look, bro, it's crazy to me how similar Trump and Boris look. Them boys, they literally are long-lost brothers. They're both kind of blabbermouths sometimes. Not kinda. And we might have Trump back later this year, guys. Aren't you excited? We'll see how that goes.
President Trump's comments.
I mean, I'm not saying like anything else is better, bro. I just want a candidate under 80. Is that too much to ask? Apparently it is in the United States.
On the NHS led to many British politicians assuring their constituents that the NHS was not going to be a part of the trade talks.
The NHS is in no way on the table.
President Trump then backtracked on his comments, saying he wouldn't consider the NHS as part of the trade deal.
A lot of trade negotiations are actually quite secretive by nature. The two sides don't really want to reveal a lot about what they're looking for in a deal. Our concern really as health researchers is that the NHS really won't be accounted for in that deal. That the UK government's preferences have been shown to be largely economic and not so much on focusing on the health of people in Britain.
The problem is that the NHS is already on the table, and it has been for a while. The politicians who are now going to be negotiating the trade deals, it's going to be across many fronts. Campaigners were saying, okay, put your money where your mouth is. If you're saying the NHS won't be in a trade deal, then let's see legislation that sets that out so it's cast in stone, and they haven't rushed to do that.
Trade negotiations cover everything at once, and it's difficult to tell how they are going to be pushing for the liberalisation of drug regulations and to what extent the Johnson cabinet would actually agree with any changes that would be proposed to the way the UK regulates pharmaceuticals. It's really a central government-led process that's not that democratic and does represent big business, and I think that's why a lot of people get very concerned and anxious around trade agreements.
There are some who say the NHS won't be harmed by Brexit, even in the event a trade deal with the EU isn't reached by the end of the year.
I don't expect that we're going to see huge changes actually in the Brexit era with regard to the National Health Service, and so I think with regard to the NHS, we're not likely to see a significant impact as a result of Brexit. I think the free trade deal will be largely focused upon the service industry, which of course is now the largest part of both the US and British economies.
Whatever effect the trade deals end up having on the UK, reforming the NHS will continue to be a big part of the country's political conversation.
People's support for the NHS in the UK is very strong. There's no other country that, when we hosted the Olympics in London, we had nurses jumping on beds, and the NHS was actually a part of that ceremony and a part of that national celebration. The UK's NHS is very important in British politics. It's an important symbol of Britishness in that context.
It is very much important, and I know you guys love the NHS, and rightly so. It is it's very impressive to have a system like that. So I want to know, what are some of your own experiences with the NHS, with private healthcare as well, which apparently is funded by the NHS too? So I guess there's just a lot of intricacies within the British healthcare system that I don't, maybe can't quite grasp. But this was an interesting video, getting back into some of those the nitty-gritty details with the healthcare system. We have a lot of work to do with our own healthcare system here in the United States, and hopefully we will be able to adopt some of these principles in the future to create a system that is more inclusive, because I don't think there's a reason for someone to be sick and, have to put down 100,000, 100K, 200K just to get better. Like, that's just weird. It really is weird. So we'll be working on that. Let me know how Brexit's going. Let me know how NHS is doing and your own opinions in the comments. Please be civil if you do talk about Brexit. It was mentioned in the video, so I feel like it's going to be talked about. And yeah, thanks so much for watching. Hit that like button, hit subscribe, and I'll see you all in the next one. Peace.